Chloramphenicol, which is a broad spectrum antibiotic, should be avoided in neonates. Let's see why. Grey baby syndrome. In neonates, especially in premature babies, chloramphenicol can cause a dose related grey baby syndrome due to reduced degradation and detoxification of the drug in liver because of deficiency of glucuronide transferase enzyme. So, chloramphenicol in neonates, especially in the premature babies, it can cause dose related gray baby syndrome. Chloramphenicol can cause dose related gray baby syndrome in neonates, especially in the premature babies, due to reduced degradation and detoxification of the drug in liver because of deficiency of glucuronide transferase. तो प्रीमेच्योर बेबीज या नियोनेट्स में जो एंजाइम है ग्लूकोरोनाइल ट्रांसफरेज उसका डिफिशियंसी होता है एंड दैट्स वाई क्लोराम्फेनिकॉल का डिग्रेडेशन और डिटॉक्सिफिकेशन कम हो जाएगा एंड दिस विल रिजल्ट इन ग्रे बेबी सिंड्रोम. The manifestation of gray baby syndrome are nausea, vomiting, abdominal distension, diarrhea, refusal to suck, cyanosis, irritability, and circulatory collapse. Okay. तो नियोनेट्स में ग्लूकोरोनाइल ट्रांसफरेज का डिफिशियंसी होता है जिसके कारण क्लोराम्फेनिकॉल का डिग्रेडेशन और डिटॉक्सिफिकेशन कम हो जाएगा एंड दैट विल रिजल्ट इन ग्रे बेबी सिंड्रोम. The manifestation of gray baby syndrome are nausea, vomiting, abdominal distension, and diarrhea. GIT symptoms like nausea, vomiting, abdominal pain, and diarrhea. Refusal to suck. The baby will refuse to suck. There will be cyanosis, irritability, and circulatory collapse. Nausea, vomiting, abdominal distension, diarrhea, refusal to suck, cyanosis, irritability, and circulatory collapse. The skin appears ashen grey color. Skin का जो color है that will appear ashen grey color. Hence, it is known as grey baby syndrome, and the mortality is high. So, chloramphenicol should be avoided in neonates. Neonates में ग्लूकोरोनाइल ट्रांसफरेज का डिफिशियंसी होता है जिसके कारण क्लोराम्फेनिकॉल का डिग्रेडेशन और डिटॉक्सिफिकेशन रिड्यूस हो जाएगा. This will lead to nausea, vomiting, abdominal distension, diarrhea, cyanosis, refusal to suck, irritability, and circulatory collapse. जो skin है उसका color will be ashen grey, and that's why this is known as grey baby syndrome. The mortality is high. See, chloramphenicol is a broad spectrum antibiotic. It was isolated from Streptomyces venezuelae. Even though chloramphenicol had a broad spectrum of antibacterial activity, it was limited to only few conditions because of its dangerous side effect, that is bone marrow suppression. Broad spectrum antibiotic, limited use because of bone marrow suppression. Mechanism of action, it binds reversibly to the 50S ribosomal unit, prevents the formation of peptide bond, and thus inhibits protein synthesis. Chloramphenicol will bind to the 50S ribosomal unit reversibly. It will prevent the formation of peptide bond and inhibit protein synthesis. It is a biostatic agent. Adverse effect of chloramphenicol: hypersensitivity reaction, bone marrow suppression, GI effects, grey baby syndrome. Bone marrow suppression, hypersensitivity reaction, GI effects like nausea, vomiting, diarrhea, and grey baby syndrome. Therapeutic uses of chloramphenicol: typhoid fever, bacterial meningitis, anaerobic infection, rickettsial infection, eye and ear infections, and brucellosis. Therapeutic use of chloramphenicol: typhoid fever, rickettsial infection, anaerobic infection, bacterial meningitis, eye and ear infection, and brucellosis. Therapeutic uses of chloramphenicol: typhoid fever, rickettsial infection, anaerobic infection, bacterial meningitis, eye and ear infection, brucellosis. Therapeutic uses: typhoid fever, bacterial meningitis, typhoid fever, bacterial meningitis, anaerobic infection, rickettsial infection, eye and ear infection, and brucellosis.